This is Where We Live on Connecticut Public Radio. I'm Luciano. Our society celebrates families and the joy children can add to them. Yet getting pregnant can be difficult for some individuals or couples. The CDC says 12% of women have trouble getting pregnant, and male infertility can be a factor in about 1/3 of couples trying to conceive. Today, Where We Live, we talk about infertility and pregnancy loss. Coming up, we hear from a psychologist who specializes in fertility counseling, and we talk to a patient advocate who has experienced fertility challenges and now helps couples today. You can join us too. 888-720-9677. That's 888-720-WNPR. You can share a comment on our Facebook page or find us on Twitter at Where We Live. We wanted to start with a personal story. So joining us now on Zoom is Julia Pistell. She's a resident of Hartford and also host of the podcast Literary Disco. You probably hear her on Connecticut Public Radio occasionally on our talk shows. Julia, welcome back.
Thanks for having me back, Lucy. Happy to be here.
For people who don't know, you have a beautiful daughter, a beautiful family, and I enjoy seeing your adventures on Facebook. Can you talk about when you and your husband decided to try to have a second child, and what has been your experience?
Yeah. So, first of all, I was laughing with one of my friends before doing this, saying, let's see if I can make it through this story without crying or cursing, because those are the two main emotional modes. But I have a daughter. I'm very, very lucky to already have her, and she was conceived really easily in a way that I think gave us a really false sense of like, oh, we're good. This is great. Easy peasy. And then we decided to have another kid around February 2020. So you know what happened there. You know, it was a really uncertain few months. We were kind of trying, not trying. And then I did actually get pregnant over the summer, and I had a miscarriage, which was awful and kind of gory and emotionally brutal. And then, after that miscarriage, kept on trying, had another miscarriage. And then I think after that second one, this feeling sank in, you know, oh no, this is not going to be easy. And maybe this isn't going to happen at all. So starting in around March, I started seeing a reproductive endocrinologist, and I'm actually in the middle of my third round of IVF right now. So the first two rounds did not go well. So it's absolutely a roller coaster ride, as they say. Although I was saying to another friend, you know, it's not really a roller coaster because there's no ups. It just seems to get worse and worse. So yeah, it's been more than a year of trying to figure this out and have the family that we want to have.
Well, first, I'm sorry to hear about your miscarriages. That's also something that I feel like a lot of people don't talk about or feel uncomfortable talking about. And so when that happened to you the first time, you know, how did you get support? How did your doctors and others help you with this and maybe the possibility of this happening again?
Yeah, so my doctors were wonderful because the main thing that they wanted to communicate was, you didn't do anything, you know, it's not your fault. This is just math. And that is something that, you know, I would love to make sure people understand walking away from this episode of the show is that there's statistics involved. You know, there's so many pregnancies don't make it to term. And that's just how it goes, especially when you're a little bit older. I was 37 when that happened. So I wasn't actually all that surprised because I had so many friends who had miscarriages. So my support system was wonderful because I reached out to probably 10 or 12 friends who I knew who had miscarriages, and they really got me through it. And they're all wonderful. And I'm really lucky that they had shared their experiences publicly, or at least privately with me, so that I knew they were there to reach out to. And then since my miscarriage, I've done the same thing. I've been the person on the other end of the line for so many women who go through this.
When you're in the process, you mentioned you're in your third round of IVF. You become almost an expert on all the different terms, and you mentioned the math and the probabilities, and you talk through how you've gotten through these rounds of IVF, and because we hear so many stories from people that it can be uncomfortable, and at the same time, it's also can be financially burdensome as well.
Oh, yeah. I mean, there's so much to say about IVF. It's really its own kind of world, emotionally and physically. And I didn't really understand until I was going through it. When you're doing IVF, that it's very consuming. So one of my coping strategies has been to just get as curious as I can about the science and really understand how it works, and what we say, even when we're talking about IVF. Because I think a lot of people, me included, before I started, have this vague idea. It's like, oh, okay, you go to the baby store and they give you a baby. It is not that. It's a really complicated, delicate process of taking hormones, injecting yourself with all kinds of things, and then having your eggs retrieved while you're under anesthesia. And I think those aspects are what we do hear about, the physical reality and the physical experience. But the emotional experience I've found to be much more difficult. I do the physical aspect of it again and again, no problem so far. But the thing that happens with IVF is you have a certain number of eggs retrieved, and then every couple days you get a phone call about how many of them didn't make it. So you start with this big number, and then it goes down and down until, like, hopefully you get one usable embryo. So it's just really difficult. And I've kind of been living in this world for a while, so it feels like it's never going to end. It feels like, oh, this is just what I do now. I go to the doctor every other day, and then I get bad news. And that's sort of my life right now. So it's been tough. And I would love for people to understand that when someone's going through IVF, it's not like a quick thing. It's a long, long process.
You're hearing Julia Pistell here on Where We Live as we talk about infertility, the challenges that individuals and couples can face when they're trying to conceive. And in Julia's case, she's trying to have a second child. You can join us if you've also experienced this, if you want to share what your experience has been. 888-720-9677. That's 888-720-WNPR. Or find us on Facebook and Twitter at Where We Live. Julia, listening to you talk about, the stress and the emotions attached to having to do this and being in a third round of IVF. Something that struck me when I was doing reading before this show is the phrase of this infertility is a lasting trauma. Even if you end up with a healthy baby, that long struggle to conceive is brutal, and it doesn't just go away overnight.
Yeah, that's something that I've been thinking about and honestly working on this whole time. At first it's like, oh, I have a problem and I'm going to solve it. And then it becomes, okay, this is a part of me now. And the infertility is almost separate from the baby. And in my case, I have unexplained infertility. So there's no reason, this is just something that happens, is the right egg isn't coming down or the right egg isn't showing up. And it's something that I'm really coming to terms with, thinking about, my life is not going to look like what I wanted it to look like. And there are certain things that I see that are really sad, like two siblings playing together who are really close in age, like that possibility is gone. So watching possibilities sort of fade out, is a really difficult part of this. And, something that I read that actually made me feel better, or at least less, a little less crazy, big air quotes there, is folks who are going through IVF have similar mental health patterns to folks who are going through cancer treatments. So it is really that traumatizing and that heavy. and not something that, I will ever truly be able to like wipe my hands and say, oh, that was bad, but now I'm done.
And given all the sacrifices that you and your husband have gone through in this journey to grow your family, this is something that you're not going to give up on, right? Like are you feeling good right now in this third round, Julia?
Yeah, I am feeling good right now. Just because of where I am in the process. I had a good egg retrieval, so that's wonderful. But I think for me, I have had to separate my mental health from the outcome of having a baby, and instead say, okay, here's what I can do to make this meaningful, even if there is no baby, even if I do this and nothing happens. So for me, the things that I've sort of latched onto are being really open about it and talking to people about it so I can support someone else later. Or, like I said, being really curious about the science. And also just there's other effects on my family that are interesting in their own ways. So my daughter is obsessed with blood cells and blood draws now because she knows I've gone to get my blood drawn a million times. So I'm just trying to stay in the moment and live in the experience, because I really don't know what will happen. And one more thing I want to say is that, even if I were to get a positive pregnancy test, I know from others who have been through this or getting pregnant after loss, that pregnancy will be really hard. There will be a lot of anxiety and fear around there. So I just happen to know that it will be a long time until I feel really, really good about the outcome of this process. So just trying to stay in it. I'm not even going to say stay positive. Just trying to keep going is where I'm at.
Well, Julia, we really appreciate you sharing your story with us. It's personal, but I think you make a big impact when people hear you talking about this. But we want to thank you, Julia Pistell, for coming on the show today. She lives in Hartford, and she's host of the podcast Literary Disco. Coming up here on Where We Live, we're going to talk to some medical experts who help women and couples who are experiencing infertility. Is this something you've experienced? You can join us, 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Luciano. There have been many advances in fertility science since the first IVF or in vitro fertilization baby in the late 70s. We just heard from a Connecticut woman, Julia Pistell, about her fertility journey as she and her husband try to have a second child. For many, the journey is emotionally, physically, and financially challenging. To talk more about infertility, joining us now on the phone is Dr. Anthony Luciano, who's a professor and leads the Obstetrics, Gynecology and Director of Reproductive Surgery at UCONN Health. Dr. Luciano, welcome to the show.
Thank you. It's nice to be here.
We heard from Julia, and she talked about how in her journey to have a second child, she has what's called unexplained infertility. So can you talk about that, and how common is this?
I'd be happy to talk about that. I just want to thank Julia for being on the show, and for sharing with us the emotional trauma that infertility has caused her and to her family as well. This is not something that's been appreciated by the society, by medical insurance, and by the medical profession for a long, long time. And in fact, infertility was not thought to be a medical condition for many years, and until recently, it was not covered by medical insurances. And even today, many medical insurances do not cover infertility because they don't think of it as being a medical problem. And as Julia has emphasized already, the pain and the suffering that infertility couples go through compares very similarly to the trauma and to the pain associated with cancer and other major medical problems. This is a real significant medical condition, and I really appreciate you doing this show and Julia for sharing your experience with us.
So how common is it, Dr. Luciano?
Fertility or infertility is about 10 to 15% common in this country. In other countries, especially Africa and third world countries, it could be as common as 40% of reproductive age couples. So the various causes of infertility include hormonal problems, include genetic problems, as well as organic problems. By organic, I mean problems with the uterus, problems with the fallopian tubes, things like endometriosis, uterine fibroids, etc. And as you mentioned earlier, about 30 to 40% of infertility is caused by a male problem. I hate to talk about causal relationship because it's not your fault and my fault. It's not the man's or the woman's fault. This is a couple's problem, which, as we said, occurs in about 15% of couples, and the problem may be multifactorial. And it is up to us to, as physicians and as experts in infertility, to specifically find the cause of the problem and obviously treat it accordingly.
I'm glad you brought that up, because do you often see patients who blame themselves for not being able to conceive, Dr. Luciano?
Indeed, that is a very unfortunate thing. When we tell couples or when they realize that they have infertility, the first question they ask themselves is, why me? And what have I done wrong? And with that question itself, there is a degree of guilt. And we spend a lot of time with couples making them understand that we are living beings and we are subject to illnesses, diseases, and the organic dysfunctions, which they are not our fault. They just happen to living creatures. When they happen, we have to focus on the problem, make a diagnosis, and treat it accordingly.
You can join our conversation as we talk about infertility. Again, the number 888-720-9677, or find us on Facebook and Twitter at Where We Live. Katie's calling in from Columbia. Katie, what did you want to share?
Hi, can you hear me?
Yes, go ahead.
Okay, I just wanted to share, I appreciate you doing this show, and I wanted to share that it's important to also acknowledge the women who go through infertility and then choose not to do more than a couple rounds of IVF, and then they're left with no child, and they have to grieve the loss of being a mother. And there's, the more I look into the community, there's more and more of us, because of what's happening in society with women being so educated, choosing to partner later in life just because of circumstances. You know, you're traveling, you're doing your career, you're looking for a partner. But for me, I didn't meet my husband until I was 37. And sometimes it's just because you're older. And I think sometimes the fertility centers, you know, of course they want to sell hope, but you're mixing hope and fear together, which can be a little tricky. And sometimes it's just that your egg quality is not there anymore and you were just older. And I think there's an important conversation where we need to say to women, like, maybe after one round of IVF, depending on, you know, your finances, there's a lot of privilege with IVF as well, because there's a lot of extra cost that comes that's not covered by insurance. But maybe we say, I'm worthy of not going through that again. And then you have to move forward to grieve the bigger loss that you're not going to ever be a mother, and then sort of rebirth yourself into that new identity. It's very challenging, but I know there's a lot of us out there, and we just don't talk to each other, and we don't really get a lot of support.
Well, thank you, Katie, for sharing that. That's an excellent point. When you talk about support, before I let you go, you know, are there community groups, organizations that help women and couples who've decided, you know, this, we've tried it, it's not working, we've got to move on? I'm just wondering if you can give a resource if you have one.
Yeah, the one I just found recently is called Gateway Women. They're out of the United Kingdom, but they have a large online presence. I haven't really joined them, but I just started listening to the person who started the group. I think it's Jody Day, and a lot of her podcasts, just she says, is just so affirming. You know, that we really celebrate motherhood, and that's how we move forward in our partnerships. And as women, a lot of family events and celebrations are all around children and family. And so you have to really, stay grounded and find people who you can talk to about this different path that has come along from circumstance, not from choice.
Well, thank you, Katie, for calling in today. Again, the number 888-720-9677. I wanted to bring into the conversation Dr. Beth O'Donnell, who's a clinical psychologist in private practice in Stamford. She specializes in infertility counseling. Dr. O'Donnell, welcome to the show.
Hi, thank you for having me.
Can you respond to what the caller Katie has shared, and the fact that there's not everyone's circumstance is different, and earlier I'd asked Julia that she's going to keep trying, but for some that's not an option. Can you talk about that?
Absolutely. I think Katie made a really important point, and the journey is not straightforward. It's different for everybody. It involves many layers of loss, a lot of uncertainty. It's traumatic. And I think this is where infertility counseling comes in, that people need help navigating. They need to know when they can give themselves permission to end or to change course, or, it's an identity crisis that they, like Julia pointed out, that people have to sometimes recreate the entire vision that they had for their lives. And one of the things that people have to understand is that if you ask a 10-year-old whether they're planning to have children, most 10-year-olds know. This is something that people envision for a long time, and it's really embedded in their identity. So it truly is a crisis on many levels.
When you talk about a crisis, when it impacts identity, what about the strain that it puts on relationships and partnerships?
Yeah, well, it does, and that part is often invisible to people in the patient's social support network. People who aren't going through infertility or pregnancy loss really don't get it. That to a patient who is, the whole world looks pregnant, and they feel so left out. It's just heartbreaking and isolating. And the thing I see that I think is most painful is the patients feel left out of celebrating other people's children. They want to be a part of that. They want to be happy that their friends are having babies. And so again, there's so many layers of loss that they feel really just on the outside. And they need help navigating that. How do they, with self-care, with boundaries, with finding people who know how to be supportive and who do get it. I think the online communities are wonderful for that, and people should take advantage for that. They need sort of strategies for getting through and protecting their support system and their life so that it's still there for them later.
I wanted to bring Dr. Luciano back into the conversation. When we were hearing from Julia, she was very honest about having to navigate pregnancy loss too, even after when women may have a successful IVF treatment, but trying to tamp down that excitement because of the chances that it won't go to term. Can you talk about that?
Unfortunately, miscarriages are very common. It is estimated that about at least 15% and perhaps as many as 25% of all conception, of all pregnancies, end up in miscarriages. The causes for miscarriages are numerous. They start from genetic problems whereby the egg and the sperm have inadequate number of chromosomes or quality of chromosomes or genes, and therefore the result of the karyotype or the chromosomal makeup is incompatible with life. Other causes are more treatable, such as organic causes, problems with the uterus, problems with the lining of the uterus, inflammatory process or infections, endometriosis, adenomyosis. These are other causes that may result in miscarriages, and fortunately, they can easily be treated surgically, medically, or with antibiotics, etc. So it is very important to look for causes, especially those that are treatable, and implement the right therapy correct it and get a good outcome.
Dr. Beth O'Donnell, we just have a couple of minutes left for our listeners who may be struggling with infertility now. What's some advice that you can give them?
So I like to tell people that the Chinese character, it's for crisis and opportunity is the same. It's the same character. And, that this is a time in their life where sometimes for the first time they're learning that life is not fair and that there's great suffering in life, and that this is an opportunity to grow in some way, whether it's growing their marriage, whether it's growing their coping skills, learning new coping skills, whether it's learning how to protect their relationships. That I think for people to come to counseling, whether it's learning better self-care, learning to love themselves, take better care of their bodies. This is an opportunity to do that. And it's important, and they will take those skills with them for the rest of their life. Hopefully they will resolve the issue, but their life doesn't have to fall apart over this. And I think that's important for people to sort of consciously recognize and grab onto.
Well, Dr. Beth O'Donnell, who's a clinical psychologist in Stanford, specializing in infertility counseling, thank you so much for coming on the show. We appreciate it.
You're welcome.
Also with us today is Dr. Anthony Luciano, professor and vice chair of obstetrics and gynecology at UCONN Health. Dr. Luciano, thank you.
You're very welcome.
This is Where We Live on Connecticut Public Radio. I'm Luciano Pathanchel. We'll continue talking about fertility challenges after the break. We'll hear from a woman who's a patient advocate for couples trying to conceive. First, it's Connecticut Public Radio's Fall Membership Drive. Support the conversations you hear each and every day here on Where We Live with a pledge. Here are two of my colleagues to tell you more.
Thanks for listening to Where We Live on Connecticut Public. I'm Patrick Scahill here with Katie Tolarski, coming to you for just a few minutes to ask for your pledge of support for local programs like this and all the national and international news you're hearing on the station every single day. We can bring you all that news. We can bring you all this information. We can bring you all these stories and interviews because you make that pledge. You make that pledge of support. So if you've done it already, thank you so much. If you haven't, here's how. 1-800-584-2788, 1-800-584-2788, or go online to ctpublic.org and make your donation there.
That's right. 1-800-584-2788 is the number to call to support Where We Live, to support all of our local programming here, all of our local news. We have 2 daily talk shows, as you know, Where We Live and the Colin McEnroe Show. We have 3 relatively new weekly programs, Audacious, Disrupted, and Seasoned. If you're enjoying those programs, if you're a listener, if you listen on your podcast or you listen on air, support it. Support the great teams that are working hard to put those programs together and to bring you the information, the news, the entertainment that you get every week, every day. 1-800-584-2788 or ctpublic.org.
Yeah, and of course, Where We Live has been exploring issues big and small across not only our state, but really our world. And one story, one show that I particularly really enjoyed was a show on Connecticut Paralympians that Lucy did a few weeks back. And it was just a great conversation with several of these really elite athletes who are from Connecticut, kind of sharing their journey, sharing their stories, sharing what it was like to compete in the Paralympics this year. And that's just, typical of what Lucy and her team do. They find these stories in our own backyard and they make them bigger and they make them really kind of relatable and approachable. And it's just a great service, really, that Lucy and her team provide to the community. They can do that, again, because you make that pledge of support. So if you're in a position to support Where We Live, we are asking that you do that now, 1-800-584-2788 or ctpublic.org. And of course, that's just one example of many shows, Katie, that Where We Live has done recently that have just been wonderful.
Yeah, I remember that show too, and I loved the story. Super inspiring. I know that they talked to an athlete. I think he was from Fairfield University and a coach, and there's been a bunch of Paralympians that have come out of this one program at Fairfield. So it really was an excellent program where I learned about, again, these people in our state that are incredible. And a lot of us don't know that they're here doing this work and working so hard to get to the Paralympics, or again, as Patrick said, that show among so many others, just a few that we've had in the past couple of weeks, a few shows that Where We Live has produced, alcohol use disorder in women, a look at shared housing, talking to oceanographer Robert Ballard. He's another big hero in the state of Connecticut. And of course, current events like the refugee resettlement as Afghans arrive in Connecticut. Is the state supporting this community? So many important topics that we are covering on a daily basis. So if you're enjoying these programs, if you're learning about our state, if you are learning from people, these great in-depth stories, we're asking you to support it. We're asking you to become a member of Connecticut Public Radio, 1-800-584-2788 or ctpublic.org.
For a pledge of $6 a month, we'd be happy to send you the Where We Live ceramic mug. This is a great mug, kind of white on the outside, has another color on the inside. I think it looks like black in the picture that I'm looking at here, but my eyes are not what they used to be. But what I can see is the wonderful new Where We Live logo, which I absolutely love, which has these they're kind of like little map pins that have been arranged in a really, really striking pattern. So you can see a picture of that on our website, ctpublic.org. While you're there, take a minute, check out all the great news and information that our newsroom is bringing to you every single day. Topics on everything from obviously the COVID-19 pandemic to the environment, to science, to other healthcare topics, to housing topics, to national and international news. We can do all that because you make that pledge. You go online and make that donation. So do give at whatever level works for you. Perhaps it's the $6 a month level to get that Where We Live ceramic mug. Lots of other thank you items are on our gift as well. But really the most important thing is that you do pledge to ensure that programs like Where We Live continue to thrive. 1-800-584-2788 or ctpublic.org.
This is Where We Live on Connecticut Public Radio. I'm Luciano Pathanchel. Who should pay to make sure air quality in schools is safe for students and staff? On our show tomorrow, we're going to hear how local towns are at loggerheads with Governor Lamont's administration over their request to get the state to help pay for upgrades to aging ventilation systems. We hope you join us for that conversation. Now, today we've been talking about infertility and the support available for couples. Rita's calling in from West Hartford. Rita, are you still there? Oh, doesn't look like Rita's there anymore. Again, you can join us if you want to share about your fertility journey, the challenges of trying to conceive, 888-720-9677, or find us on Facebook and Twitter at Where We Live. My next guest went through a 6-year struggle to conceive, and she saw firsthand the many misconceptions and the stigma that surrounds infertility. Today, Lisa Rosenthal is a patient advocate for women and couples, and she helps connect them to responsible fertility treatment. Lisa, welcome to our show.
Hi, thank you for having me. I'm delighted to be here.
And again, Lisa is a patient advocate at Reproductive Medicine Associates of Connecticut. So I mentioned that you are a patient advocate. You also understand firsthand what it's like to have fertility challenges. Can you talk about that time in your life and how it led you to the work you're doing today?
Absolutely. I assumed at 26 that I would have no problems getting pregnant. And this was quite a long time ago. And I had terrible problems, 6.5 years of infertility, watching my friends get pregnant, suffering through 2 pregnancy losses of much wanted babies. And it really instilled in me the realization that incredible, and this was 30 years ago, Lucy, it instilled in me the incredible realization that this was both a personal experience that I was having, but also a collective experience that many of us were having. And it really forged my entire life's work and career and passion. And I've been in infertility and supporting people through trying to build their families ever since.
Tell me about the family you have today.
I am blessed and lucky, and really lucky to have 3 beautiful children, one at a time, luckily as well. And, it was interesting listening both to Julia before about how it never goes away. So one of the groups that peer groups that I facilitate is Parenting After Infertility. We form lifelong friendships. So there are women on the Parenting After Infertility group that they have 6-year-olds, they have 7-year-olds, they have 2-year-olds. Last week at a Resolve New England walk, many of them came out with their children in strollers to support those still going through it. And it's just a remarkable thing. And I did want to just mention Katie, who called in, speaking so eloquently about what happens often with infertility. And the biggest challenge, I think, with infertility is that if we were to tell somebody, you're going to go to a fertility practice, you're going to spend 3 years there, you're going to spend more time, money, and energy than you ever wanted, but at the end, you're going to have a child. It would be a different experience, Lucy, but we can't make that guarantee because that guarantee isn't real. And the truth is that knowing when enough is enough for each of us, as Katie was alluding to in her call, we can't see giving up as failure. We can see it as moving on. We can see it as making a decision. And these are very personal decisions.
When we think about the families that go through many rounds of IVF, how does insurance handle that? Is this something that is attainable for some families, or it really does depend on your insurance coverage?
Well, we're lucky in Connecticut. We are one of the 19 states that have a state mandate or insurance bill. However, I'm actually working with a coalition called Affordable Families because one of the things that our state mandate in Connecticut leaves out is any provisions for single people or the LGBTQ community who also suffer from infertility. So we are there's a constant conversation, and that's what I meant by sort of personal and collective. So there's a conversation going on with our legislators on a regular basis about infertility and why, as Dr. Luciano also discussed, why is reproductive disease, which this is acknowledged as reproductive disease by the American Medical Association, why it is not covered like other diseases are covered.
It surprises me when you mentioned LGBT individuals and individuals. That's still an issue here in our state because we think of Connecticut as being very progressive. There was something that was signed recently, the Parentage Act. Tell me how that will help the couples and clients that you counsel.
We're very, very proud of that. And that was a coalition that worked very, very hard. And big thanks to Representative Jeff Curry for really helping us push that through. The Connecticut Parentage Act means that somebody will no longer have to go through a costly and time-sensitive second-party adoption of their own children. And it confers on an LGBTQ couple the same rights that we have for a hetero couple, that the parent is going to be acknowledged. And that goes into effect January 1st. So we're very, very excited about this. It really makes big changes for that community.
You're hearing Lisa Rosenthal here on Where We Live. She's a patient advocate at Reproductive Medicine Associates of Connecticut as we talk about infertility and hear first-person accounts of this journey that is not uncommon, but we just don't talk about it enough. You can join us, find us on Facebook and Twitter at Where We Live. Lisa, when we think about infertility, would you say it's fair that most people think of it as a problem of upper middle class or white heterosexual couples, but we know it's more diverse than that? Can you talk about the people that you're supporting in your role as patient advocate?
Yes, thank you for the question. I have for a long time felt like we have looked at this in a very elitist way, in a very privileged way. And because of organizations like Fertility for Colored Girls and Broken Brown Egg and Frances Brown and Shantana May from Sister Girl Foundation and Black Women in Infertility, Siobhan Coney, these are the women to listen to. These are women of color who are talking about their experiences and their individual needs. And I defer to them about how they talk about the experience. But I will say that 1 in 8 couples have this experience, and it is completely unbiased. Infertility is completely unbiased. It doesn't care, what color or what race or how you identify or what your gender is. There's certainly certain things like endometriosis and PCOS Challenge is another great organization that absolutely do affect women of color much more than they affect white women. And so, again, we really need to be aware of these differences, and we need to be aware of our privilege.
You said PCOS. What is that?
Polycystic ovary syndrome. We just finished September as PCOS Awareness Month. And in fact, Lucy, I'm not sure if you're aware, but October is Pregnancy Loss and Infant Loss Awareness Month. So it's really wonderful that you're doing this show today.
Well, producer Tess Terrible gets props for scheduling that, especially this month. When we talk about patients of color, we know in our country, just the health disparities that disproportionately impact communities of color. So when we talk about women and families of color, how are they treated in this space? Because as we've heard earlier, this is an emotional time. There is definitely a psychological toll that it takes on individuals. I'm wondering if you can talk about that at all.
I can talk about it only in what I have heard from them. I certainly can't speak to it myself. And so again, I defer to their voices. And what is true is that just like in every other part of healthcare, they're not necessarily listened to the same way. They're not diagnosed as quickly. And this is true of a lot of women's diseases as well. But for women of color, it becomes even more paramount to be as much of your own advocate as possible. But the problem with being your own advocate, and Julia was talking about this, is that we get exhausted, we get disappointed, and the failure of things to happen make it even more challenging to advocate for ourselves, which is why it's so important that we have advocates who can speak for people as long as we're very clear about what their message is, when they don't have the emotional energy to speak for themselves. And I think that this disparity, again, with the organizations that I mentioned before, is starting to change. It's being talked about more, and there's more awareness, and the awareness is where it has to begin.
Just a few minutes left, actually 3 minutes to go, Lisa, but we are still living in this pandemic. We know that the pandemic had really changed how patients interact with their medical professionals. How did COVID impact how you're reaching couples and individuals that need support?
Well, I love that question, Lucy, because in the middle of this pandemic, we actually went through an institutional review board and did a research study on COVID-19 and how our patients were affected. And it was actually accepted by the American Society for Reproductive Medicine for their conference this month. And what we found was that telehealth conferences actually do a great job. And I don't want to reveal too much information, but patients really felt that their physicians were focused, that they were there, that they were present. So that was one thing during the pandemic that we found that was really wonderful. And in fact, patients stated things like, I don't have to drive there. If there's terrible weather, I don't have to cancel. If I'm sick, I don't have to cancel. So there was actually a brightness. Now, I know that during the pandemic, it was pretty brutal for a lot of people in a lot of states. But in Connecticut, we were lucky enough to have infertility and fertility treatment to be considered essential services. So we were closed for very short amounts of time.
Well, Lisa Rosenthal, it's been a pleasure to hear from you. I can hear the care in your voice that these couples and individuals are lucky to have you as a patient advocate at Reproductive Medicine Associates of Connecticut. If people wanted to reach out to you, Lisa, what's the best way?
The best way really is to go to rmact.com, and you can find me easily. And my phone number, 203-240-6122. One of the things I love about my job is that I am a patient advocate Yes, I work for Reproductive Medicine Associates of Connecticut, but you do not have to be a patient of RMA of Connecticut. So you can just call me if you need a little extra help and support.
Well, thank you, Lisa. We'll be sure to share that with our listeners on our website, ctpublic.org. Tess Terrible produced today's show. I'm Luciano Alpathanchel. If you listen to Where We Live regularly, you know we cover a wide variety of topics on this show, and we aim to bring you stories of Connecticut residents and our communities. Support Where We Live and all the programming on Connecticut Public Radio. It's our fall membership campaign. Here are two of my colleagues to tell you more.
Thanks for listening to Where We Live on Connecticut Public Radio. I'm Katie Tularski here with Patrick Scahill. Excited to be asking for your support, to be asking for you to become a member here at Connecticut Public Radio during this fall membership campaign. Here's how. Call 1-800-584-2788 or go online to ctpublic.org. You can check out our new webpage. Lots of things that we are bringing to you every single day, whether it is on our weekly talk shows, our daily talk shows, out of the newsroom, our monthly Cutline TV specials. We have a new accountability project that is doing some incredible investigative reporting. So many ways that your dollars are utilized to bring you the news, important news and stories every day. 1-800-584-2788 or ctpublic.org.
Yeah, and one of the main missions of Connecticut Public is to meet folks where they are. So it might be on TV through our Cutline specials. Maybe it's on our website. Maybe it's on social media. Maybe it's on the radio. Maybe it's in podcasts. Maybe it's in the classic print story that's now on our website. We can do all that, and we've been expanding all of those offerings because you make that pledge, you make that donation. So it's not only going to programs like Where We Live, it's going to all the great news, all the great content that you're getting here at Connecticut Public, all the stories, all the interviews, which and I'm sure in your head you can think of several just kind of right now, even as I'm saying this. We can do that because of you. So make that pledge right now, 1-800-584-2788 or ctpublic.org.
For $6 a month, you can become a sustaining member of Connecticut Public Radio. It's so easy to support the station and to know that your dollars will continue to bring this programming to you day after day. And again, for that $6 a month, you can grab yourself a Where We Live ceramic mug with the cool new logo on it. So many other thank you items, so many ways for us to thank you for your pledge of support at ctpublic.org. Check those out. And again, the important thing is that you're calling and supporting the programming here, especially Where We Live, our great team. We have two new producers here, Katie Pellico and Sujata Srinivasan. Really incredible team working so hard with Tess Terrible and Luciano Alpathanchel every day to bring you really important, interesting conversations. Call and support them now, 1-800-584-2788 or ctpublic.org.
Yeah, and those conversations are, looking at big issues, not only in our state, but also in our world. But they're always kind of filtering those through a local perspective. So you're hearing local voices talking about big picture stuff. So if you value that, we obviously do. We're hoping you do as well. 1-800-584-2788 or ctpublic.org. And thanks.